The science is clear. The problem is the word is not out there. And people then run off to the oncologists. And when you ask them about metabolic therapy, metabolic oncology, they don't never heard of it. So how are you, your very healthcare providers are almost clueless as to the biology of the disorder they're treating. If they don't know that it's a metabolic disorder, that's a tragedy. Minimal exercise. The obesity epidemic has now replaced smoking as one of the highest risk factors. If you have type 2 diabetes and you're obese, you're at super high risk for cancer. This should not be a mystery to anybody. So in fact, as I said, we've managed a lot of it with the smoking reduction, but now we're creeping up again with the obesity epidemic. We developed the glucose-ketone index calculator, which allows anybody, whatever kind of a diet you want, Mediterranean diet, pescatarian diet, Paleolithic diet, all of these different kinds of diets, carnivore diets. You look at your glucose-ketone index, and that tells you what level of nutritional ketosis that you're in. So we get people into nutritional ketosis, and then we attack the tumor cells using off-label, off-target drugs. That's another thing. The therapies that we use, these drugs are cheap. You can't make any money on them. You can't make money on any of the stuff that I'm talking about. So, and that's the great tragedy. And that's why it can never happen, because nobody can figure out how to make a buck on it. But we know it works, and it works really, really well. But there is a requirement here, and it's called personal discipline. Yes. You have to have some level of discipline to get your glucose-ketone index, yes, which could take on a very low carbohydrate diet, and you can use any kind of a low carb diet you'd like. It might take 14 days to get into a GKI. And then we jump for a few days into water-only fasting, and then we hit them with the drugs that actually hammer these tumor cells out of existence. Once you put the body in this new metabolic state, these tumor cells become extremely vulnerable to very small doses of various whole array of different kinds of drugs that go after the glucose and glutamine. It's an elegant, a beautiful, non-toxic way to get rid of cancer, but it does require the patient to participate in the outcome. You're not just going to sit there and have some part of your body irradiated or chug down some sort of a toxic poison. This is a patient participatory activity. And I understand there are some people who choose to go standard of care. They don't want to take charge. And there'll always be an avenue for those guys. If you want to be irradiated and this surgical mutilation, removing breasts, it was already shown years ago that there's no redeeming survival advantage from a lumpectomy versus a mastectomy. And yet the evidence is published, yet the poor women are being mutilated. There's so many ways to go about managing this disease in ways which are different from what's going on in most of the clinics today. Glucose is measured in milligrams per deciliter. Ketones are measured in millimolar. Just get your blood sugar and push the button, boom, on the meter, and it gives you the ratio right there. You don't have to get a paper and pen or use your brain to do the ratio calculation.
Okay.
So it just, people know, oh, look at my GKI. We're not 100% sure that ratio will always be an accurate indicator of your present status, because there can be some really strange metabolic things happening in a person's body. So there's always other measures that should be looked at along with the GKI. It's not to be looked at alone as a simple entity. You have to look at the blood work. You have to look at all the metabolites that are also in association with that. And you start to see the overall physiology move closer and closer to what would be considered ideal health. At the same time, the person has a tumor, and yet the body is in ideal health. And the tumor now is going to be you have a chance to really rip into those cells and kill them with various dosages and timing of these drugs. This is the future. This is the management of cancer if we want to stay alive from this disorder.